Good morning, everyone.
Всем
Uh,
доброе утро.
First of all, I'd like to thank you for inviting
Знаете,
myself and
хотела
allowing me to
поблагодарить за
invite
то,
a
что меня
couple of
пригласили на
absolutely
этот вебинар.
superb plastic
И
surgeons
рад, что
to
мне
this very
досталась
important
возможность
conference.
представить двух
Um,
замечательных
my
хирургов,
name is
которые
Simon
выступают
Davis.
на
I've
этой
been involved with
конференции. Меня
Vaser
зовут
for
Саймон
about
Дэвис.
12
Я
years or so,
работаю с Vaser
and I'm
около
currently
уже
managing
12
Vaser
лет.
throughout Europe,
И
Middle East, and Africa.
в
And
настоящее
it,
время
again,
занимаюсь
it's an absolute pleasure
продажами
to be
этого
presenting.
аппарата
My
в
presentation will be
Европе,
very brief.
Средней Азии
Um,
и Африке.
Let me see.
И давайте перейдем
It's
к этому.
important to remember Vaser is what we like to call the third
Vaser–
generation
это третье
of
поколение
ultrasound being
аппаратов,
used in
которых
lipoplasty.
используется ультразвук для
Ultrasound was first
липопластики.
developed in the 1980s,
Вначале эти аппараты
but
появились
over
в
the
80-м году.
20 years or so that it took for
За
Vaser to be
20 лет
developed, Vaser made
они
some very
существенно изменились,
significant
и вот теперь мы
advances in
работаем с третьим
applying
поколением этих
what I
аппаратов,
refer
и
to
в
as a
частности с
cold
Vaser.
technology
Это так называемая
that is
холодная
incredibly selective.
технология, и
So
она дает
we really
возможность
see
реагировать
Vaser as the
превентивно.
paradigm for selective
Vaser поменял
emulsification
paradigmu
of human
восприятия
fat.
липосакции, и
Vaser
сейчас
has
мы
been around for
работаем
many years.
селективно, без
It's not a
разрушения
new
ультразвука.
technology,
Это
but
не
as I'm sure
совсем
you will
новая
see and
технология, но,
understand
как
from
вы
my colleagues,
увидите
even
по моим
today,
сообщениям,
there are
посвященным моих
procedures
коллег,
and results that you can only get
результаты,
when you
которые вы
incorporate Vaser.
получаете с
The
Vaser,
technology
возможны
has been
только с
backed up
применением
with
этого аппарата.
many
Наши технологии
peer-reviewed clinical studies.
основываются на клинических
And I'm happy to say
исследованиях.
that we're selling
Мы
Vaser globally.
делаем
We have
публикации в
Vasers
репутированных журналах.
almost in every country in the world
Практически в
with
каждой
people that
стране
love using the system.
есть аппарат Vaser, и всем
Um,
специалистам очень нравится
since the
работать с
procedure is a
этой машиной.
three-step procedure, infusion, emulsification or separating of the fat, and then aspiration, we provide all those things in our system. So we have an infiltration system that measures exactly how much fluid you put in. We have the Vaser amplifier, which delivers the ultrasound waves. And then we have the Ventex aspiration system to suck out the aspirate. And quite wonderfully, the whole system is controlled with two wireless foot switches, so there are no cables draped across the operating room floor. This is a slide that you may see many times over the course of today. We basically took an abdominal flap and applied Vaser to it, and then opened the flap to see what the effect was. And essentially, you can see that the ultrasound from Vaser is very selective. It only affects the human fat cells. So the connective tissue matrix, the vasculature, and the nerves remain intact post Vaser, which means you get faster recovery, you get very good skin retraction, and you get far fewer complications because we're not damaging any of the collateral tissues. So because we're selective, we are able to deliver very little energy to get a very big effect. We are what I refer to as a cold energy source. So there's no thermal mechanism of action. We're not applying heat to the tissues, which means it's safer. And everything we design is atraumatic. We don't want any of our cannulas or probes to cause any tissue damage. We simply want to turn a solid subcutaneous fat to a liquid, which can then be aspirated. The viability of Vaser fat has been shown with multiple clinical studies, so it's a very good substrate for autologous fat transfer. And both my colleagues who will be presenting today use Vaser fat in almost every Vaser procedure they do, to either do augmentations to the buttocks or the breasts or the pectoralis muscles, So Vaser fat is very, very viable, upwards of 90%, with a very, very high concentration of stem cells. So that supports the graft to acquire a new blood supply. So without further ado, thank you for allowing me to speak. I'd like to introduce, first of all, the first speaker will be Dr. Jordi Mir from Barcelona, who is an outstanding plastic surgeon who has done many, many Vaser procedures over the years. And then secondly, Dr. Jamil Hayek from Lithuania, who is just a phenomenal practitioner. Some of the results that Jamil has shown me have really been breathtaking. So I hope you will all enjoy this and take away some very positive thoughts about Vaser and what you can do with this selective tool. Okay, thank you very much indeed.
Каким образом можно пользоваться аппаратом Vaser в вашей практике? Спасибо.
Саймон, спасибо большое.
Simon, thank you very much.
My pleasure.
Спасибо.
Hello, good morning.
Доброе утро.
Can you hear me? Can you hear me? Yes? Okay.
Yes, we can hear you well. You can proceed.
Доброе утро. Я Jordi Mir, пластический хирург из Барселона, Испания. Приятно говорить с русскими пластическими хирургами. Я немного говорю по-русски, поэтому буду говорить с тобой на английском. I just say good morning in Russian. It's a pleasure to talk to you. Thank you, Simon, for your nice presentation. I want to talk to you about the Vaser lipo tips. We like to talk most about practical things than about chemical things. We'll talk about normal Vaser lipo and about high definition lipo. Nothing to disclosure. Let's talk first about the place of Vaser-assisted lipo in modern plastic surgery. In our team, for example, last year, we did 143 liposections. I started with Vaser lipo 4 years ago, and nowadays, last year, I did only one normal lipo, and the other 142 lipos were Vaser lipo. Why? Because of the results. With Vaser, you can reach results never seen before, as you will see at the end of this presentation. Well, we did 142 Vaser lipo, and from these, the 80%, 114, were high definition Vaser lipo. Why? Well, it's not normal, really. The normal thing will be the opposite, that the 80% of lipos were normal Vaser lipos are only the 20% high def lipos. But in Spain nowadays, Vaser is a technology that was introduced 4 or 5 years ago, quite similar from Russia. So the high def is commercially very sold. But I think that in some years, in 5-10 years, the tendency will invert, and the majority of Vaser lipos will be normal lipos, like happens in the United States nowadays, for example. Well, our perspective, we think that traditional lipo is on the way to extinction. Why? Because patients don't just want to look thin, they want to look better. From many years ago, it was seen that liposuction needed an artistic makeover because patients want to look themselves better immediately. And another important thing is that ultrasound-assisted lipo, Vaser, the results last longer than traditional lipo. We have seen patients operated 4 years ago that are now better than 3 years ago. Why? Because if you make a sport, if you follow a diet after Vaser, the results are a lot better with the pass of time. That's the opposite that happens with the normal lipo. With the normal lipo, the best result is at 1-2 years, and 5, 6, 7 years after the normal lipo, the results are worse than 1-2 years after. Vaser inverts this. Also, a very, very important thing that I like to talk to you, my Russian colleagues, is that Europe seems, we are convinced that Europe seems to be the field where ultrasound-assisted lipo with Vaser power, assisted lipo with PowerX and high definition are going to grow more in the following years. Advantage of this technology. Well, we see 5 easy advantages. First one is to get the maximum definition with six-pack, pecs, obliques, arms, from face to any part of the body. Second is the more extraction of fat and more regular result. The third is that allows lipofilling. This is really, Simon was talking about that. This is like a controversy with people that doesn't make Vaser. Just see the results. But if you use a power of Vaser under 80%, the viability of the fat is around 85%. So if you're going to do lipofilling, go below 80% of power. So simple as that. Fourth point is the greater skin retraction. So the fifth point is the best result. I want to pay attention to number 2 and number 4. So more extraction with fat, with more regular areas, and the retraction. These 2 things allow to reach this result. The question that many times they made me is, can you achieve high def with the traditional lipo? Well, yes, you can. Yes, you can, to a greater or lesser degree. But it's demonstrated in all the world that the combination of ultrasound-assisted lipo with power-assisted lipo is the most efficient system. It's up to you. It's up to you. If you're a plastic surgeon that you don't know Vaser and that you are seeing this for first time, it's your opportunity to change your life. In these last 4 years, my life has changed. I was a normal plastic surgeon in Spain, and now it's said we are one of the best teams in the country or even in Europe. Well, I don't know that. What I can say certainly is that my life professionally changed completely. Why? 3 aspects. First, patients reach results that they didn't expect, so they are a lot happier. Then my team is happier working, and then I am happier. My life is better. My life is better with Vaser, definitely. So I encourage you to take the decision of change your mind and try ultrasound lipo. Try ultrasound lipo. There is a learning curve, obviously, but if you do it, your life will change. Let's talk about about high precision liposculpture. Well, the first is the infiltration. The infiltration is quite similar of the normal lipo. What we do is ringer lactate, and for 1 liter of ringer lactate, we use 1 adrenaline. We don't use lidocaine. Why? Because of the toxicity. We always do this surgery under general anesthesia, and then we infiltrate them mainly around 4 liters because we extract around 4 liters. That is the media. Under general anesthesia, that's about 3-4 hours of surgery. So we say that the infiltration is quite similar from normal lipo. How does the sound? Well, this is quite technical aspect, but we're talking about cavitation. Cavitation is that the bubbles that we introduce with the tumescent fluid, they just, when they are 180, they become liquid, 180 microns. So we can extract liquid instead of solid. First part of Vaser is the superficial. This is the main difference, the main thing that we have to change our minds. when we introduce the probe of ultrasound, we start with superficial. Why? Because we need this fluid of the infiltration in order not to burn. I take profit to say that the new generation, the third generation, has a big difference, as Simon said, with the first generation. With the half of power, we have the double of efficiency. That it's the same to say the safety. It's really difficult to burn with this new technology, right? So first superficial, and then deep ultrasound. The ultrasound is between the infiltration and the aspiration. The aspiration is quite similar from a normal lipo. We use the power-assisted liposuction with the PowerX. PowerX is a cannula that rotates, a power-assisted lipo that rotates. This allows to extract more fat with less trauma. And there is a fourth effect, the retraction of the skin. Well, at the end of the surgery, we do the high def. This changes a bit. In females, we do it at the end. In males, now we try to do it at the beginning of the surgery, but this makes part of the learning curve. What I want to show you with these images is, if you see the six-pack, there is like a pinch test there between 0.5 to 0.7 centimeters. And in the other way, below the umbilicus or lateral to the semilunaris line, the pinch test is 0, is skin to fascia. This is very important. The last thing we do is the lipofilling. We can do lipofilling of the pectoralis and pectoralis in males, and buttocks in females and males are the most common. Also, we do from the deltoid in males in order to have the V, and biceps and triceps and gastrocnemius as well. It's the most common we do. In pectoralis, we do it submuscular, deltoid as well. What we do superficial since 3 years ago, it's gluteus, and you know that since 3 years ago it's forbidden to do intramuscular with gluteus lipofilling with PDL. It's very, very important. Here we have the gluteus lipofilling. It's superficial. Here in Spain, well, in Barcelona, I operate from Barcelona from around 20% of patients are from outside Barcelona, from Madrid and blah, blah, from the rest of the country. And around 2-3% of patients are from foreigners, from the rest of Europe, some are from America. Where I live, the big buttocks is not a good idea. So what we use usually is a lipofilling of between 200 and 500 per side, always superficial. We use drains always. In males, we put 2 drains in the tummy and 1 in the back, and in females, only 1 in the back. These drains are there until they extract less than 60 cc per day. That's around 5 days. Well, this photo that was shown by Simon, it's a photo that I see every week with the patients, because we do Vaser surgery nearly every day, and we do 1 or 2 times a week combined surgery. And one of the most combined surgeries we do is with tummy tuck, and it's very, very, very nice when you open and you see the tunnels with the connective tissue preserved, with the vessels preserved. This may be the most important thing that I want to say to you today are the tips that I want you to have about Vaser. First one is very important when you are starting, when you are with the learning curve. Offer less than what you're going to give. That's to say that if when you're starting, maybe in your first months with Vaser, don't offer to the patient being like Cristiano Ronaldo, for example. Just say, you're going to be a lot thinner, and we will show you some lines, subtle, and then try to give more than what you offered him. right? The second thing is a good patient selection. This is maybe the most important thing. What we do is we do not operate a PMA above 25, 26. We are very restrictive. There are many teams in the world that operate PMAs below 29, 28. That's great, but fortunately, we operate every day and we can ask for that PMA. Also, this is because what I told you first, that 80% of our patients are high-def patients. And not only the VMA, also the fat percentage. We ask in males for fat percentage under 20 and in females under 30%. And what I called the 3 T's, the 3 safety T's. First one, temperature, avoid hypothermia. Always liberating room without cold. Always some thermal blanket for the patient. Always, especially not in the trunk, in the extremities, in the arms and in the legs. Hypothermia. If you lose 2 degrees of temperature, the patient will bleed around 70, 80% more. So this is very, very important. Avoid hypothermia, the first T. Second T, hemoglobin 13 or more. 13 or more of hemoglobin. If not, from 1-2 months before, iron, oral iron for the patient. But it's very important, 13 of hemoglobin in order to avoid blood transfusion. Why to avoid blood transfusion if these patients bleed less than with a normal lipo? Because as the trauma is less, they will ask you for more zones. And the majority of surgeries that I do yesterday, now in a couple of hours and tomorrow, are patients that want a total body liposculpture, that want a change of their lives, because they have seen the results that we can reach with this technology, and they don't only want the trunk. Many times they want legs, arms, neck. And the 30, that's quite new concept. I recommend you tranexamic acid, 1 gram, 30 minutes before the surgery. The great master, Alfredo Hoyos, creator of the technique, is going to publish in a few months, next year in few months, in the plastic, I think, a work he has done, that he tried three things. One was this, the tranexamic acid 1 gram, 30 minutes before. Another one was just before, and another one was in the solution of the infiltration with tranexamic acid. And when he found differences in the first one, and I knew this concept since around 2 or 3 weeks ago, and I started doing it, and I've realized a big difference. So tranexamic acid, 1 gram, 30 minutes before the surgery. There is another tip, important tip. With males, we try to do the lines first, and with females, lines the last. Why first with the men? Because what I told you, in the packs, you need a 0.5, 0.7 of pinch test. So if you go with the lipo first, it can happen that you do a lot of lipo and then you don't have fat for the packs. That's it. Fourth, fifth tip is a trained team. You have to have a trained team. Always I say that I am working with the Ferrari. Vaser for me, it's the Ferrari of the surgery. For me, it's the invention of the center in aesthetic surgery. I have no doubt about that. So that what have I gave to Vaser? My team. I have a big team that we try to work every day the same way in order to make things as better as we can. So it's very important to have a trained team. And the last thing is a recovery and follow-up. That is also part of the team that has to do it. It's very, very important. Okay, let's see some results. You have a result of a normal lipo, not high def. You see how the tummy becomes flat and retracted, and also the legs. You can see the inner part of the legs of the thigh. Here is a high def with a female marcation. What's the difference between the female marcation and the male marcation? The main difference is the transverse lines. I recommend you not to mark transverse lines, not to mark six-pack, no in females, because it tends to masculinize. I will show you some six-pack in females, but my recommendation is not to do it. This is a female classic marcation that we like most. You can see the supraumbilical line, linea alba, also the semilunaris line, and the obliques. This is another female marcation with Vaser, with skin retraction. Here you can see high-def six-pack marcation in female patient. When they ask us for a six-pack, what we try to do, this is another tip. You know that for marking the lines, they mark more if you go in perpendicular direction. So we mark the vertical lines with 4 millimeters cannula and the transverse lines with 3 millimeters. When we are marking, doing a six-pack marcation in a female patient, we only pass in one direction in the transverse lines in order to do a less marcation, unless she asks us for extreme marcation, like this case. Also, we nearly always, more than 90% of patients, of female patients, we add the buttocks, Brazilian buttocks lipofilling. Around 300 is the median that we use, not a lot. This is a case of high def in a patient who is 52 years old, with all the trunk, with a buttocks lipofilling of 300 per side. And this, in males now, this is a normal Vaser lipo with no high definition. There's a man that comes, I'm in my 50s, I want this tummy out, he plays sport, but I don't want marks. So you do a normal lipo, and the retraction allows to show his marks also. And most of males ask us for a high def. He's a patient that we see just about 1 month or 2 months ago, in his 1 year after surgery with a six-pack marcation. You can see the linea alba, linea semilunaris, obliques, serratus, and transverse. It's very important to paint the surgery before, to draw before, and to put the muscles where they are. Because if you see the first line, the first transverse line, it's not regular. The left is upper than the right one. So, and this gives more natural, so more nice. And you can also see why they say that this surgery is the surgery of the shadows, because the beauty comes with the shadows. This is another case of a high-def extreme definition in a man, quite similar marcation, six-pack, serratus, linea alba, supraumbilical, linea semilunaris, and obliques. Well, and only 1 minute to say what I was talking to you before, that you can combine this surgery with other surgeries, always looking what amount of lipo you're going to do. But the two most common combinations are, one, the tummy tuck or the mini tummy tuck. Here is a mini tummy tuck with a combination of a Vaser of all the trunk and the legs with buttocks lipofilling. But this patient obviously needs applicature of the rectus, so we do a mini tummy tuck. And the other most combination is with a breast augmentation. You have here a Vaser with a breast augmentation or a mastopexy. It's quite common. That's it. Here you have another patient of Vaser. Thank you very much, and big pleasure. До свидания. Спасибо.
За презентацию. Я записала несколько вопросов, если вы позволите, я их вам задам сейчас. Вы прекрасно сказали, что Vaser – это Феррари в мире хирургических машин, и по вашим результатам это так и выглядит. И вот первый вопрос. Если результаты после Vaser-ассоциированной технологии усиливаются со временем, скажите, пожалуйста, за счет каких механизмов результаты улучшаются, в отличие от обычной традиционной липосакции?
What is the difference between Vaser in this respect and traditional liposuction? Why we have better results after some time?
very good question. And it's a question also, it's difficult to believe what I'm going to say, but this is only the experience gives you. I remember my master, Fred Hoyos, when he told me this concept first time, you don't believe until you see with the pass of time. For one reason, for retraction, for the adherence. The immediate result is better than a normal lipo because of the emulsification, because it's easier you can have a better result if you aspirate a liquid. You can aspirate more and the result is more regular, but this is immediate. But after the pass of time, as there is the retraction of the skin, the adherence of the skin allows you that usually patients look better, so they have a fit life. And if you have a fit life, this adherence allows to show you a better body with the pass of time.
А вы еще упоминали о ретракции кожи после Vaser-ассоциированных операций. Каким образом вы достигаете результата ретракции, используя технологию?
How we achieve skin retraction result? How it is possible?
Well, it's not me, it's not my technique, it's Vaser. As
Это
we said,
не моя заслуга. Это не моя заслуга.
as I said, there are two Vaser phases: superficial that retracts and deep that emulsificates.
А какая примерно температура в тканях в поверхностном подкожном слое жира? До какой температуры ультразвук нагревает ткань? Вам известно?
Well, maybe Simon could answer this question better. Simon.
Simon, if you turn on, okay.
Mm-hmm. It's a misconception that ultrasound delivers heat.
Есть некоторое недопонимание, почему-то считаю.
Okay, the only way that heat is generated by ultrasound is a mechanical friction effect of the solid probe with dry tissue. So we've done some in-house work looking at skin temperatures and probe temperatures at the tip at different Vaser settings. And even at the highest Vaser setting, in well-infused tissue, the change in temperature is 1 or 2 degrees, nothing more. The heat issue becomes a problem when you are applying ultrasound energy in dry tissue. That then generates friction, which can generate significant heat. But in well-infused tissues, you really don't see any change in temperature. Now, in addition to that, the other misconception is, in order to get skin retraction, you need to heat the superficial layer. And quite honestly, we know that's not the case. The skin retraction that is involved with Vaser is a direct result of the preservation of the connective tissue matrix. So as long as you preserve that connective tissue and you remove the subcutaneous fat, the connective tissue fibers can then shrink back to their normal level because they're no longer under tension from the fat, and that will bring the skin back. the third point I'd like to make is it is very, very important post-operatively to choose and use the right garments for compression. So that will also impact the degree and the quality of the skin retraction. Okay?
Спасибо, Саймон. И у
Thank you,
нас,
Simon.
пожалуй,
Да.
последний вопрос к доктору Миру.
And
Как
I think
много
this is the last
вайзер-ассоциированных
question to
операций вы
Dr.
уже
Mir.
сделали за свою практику?
How many
И
Vaser operations
как бы вы
you
определили
performed in your
показания
practice?
и противопоказания к
How you
применению
define
технологии Vaser?
indications, contraindications for the use of Vaser technology?
Repeat the last one, please.
What are, in your opinion, indications and contraindications to use Vaser technology?
Okay.
And how many operations you've already performed?
Well, last year we did around 140 surgeries, and we are with this technology since 3 years ago. So I think that we will go around 500-600 surgeries, and around 80% of them high-def surgeries. Nowadays, for example, we are doing a Vaser per day nearly. This week, for example, we are doing Vaser per day. But I always do another surgeries, breast.
Спасибо огромное, да.
And about the indications, I always indicate in a lipo a Vaser, always. If there's normal lipo is indicated, Vaser is indicated. So I don't do normal lipo.
Спасибо огромное, доктор Мир.
Thank you very much, Dr. Mir.
Мы надеемся встретиться с вами вскоре в эфире еще раз.
We hope to see you on our webinars.
Саймон, не могли бы вы представить Джамиля нашей аудитории?
Simon, would you be so kind to introduce Jamil to our audience, please?
Of course. Thanks, Jordi. That was, as usual, a phenomenal presentation. And the fact that you're bilingual is even more impressive. So now it gives me just an absolute pleasure to introduce Jamil Hayek from Lithuania, from Vilnius, who is a slightly younger plastic surgeon, incredibly talented with Vaser, has been using Vaser for probably a year now, I think. And I think Jamil's perspective is going to be very interesting because he is a relatively new user in terms of Vaser. He has a phenomenal practice in Vilnius, a broad spectrum of aesthetic plastic surgery procedures. And I'm looking forward to your presentation, Jamil. So I will now pass it over to you, and thank you again for joining us.
Hello, everybody. Меня зовут Jamil Hayek. Я пластик-хирург. So I don't speak Russian, but I'm trying my best. Simon, thank you very much for the kind invitation, and for Nina and the Premium Aesthetic for inviting me today to present. I hope you can see my presentation now. Okay, guys, so I am, as Simon introduced me, actually I'm based in Kaunas, not in Vilnius, but Lithuania is quite a small country anyway. I'm new to Vaser, yes, nearly a year now since I started working with Vaser. And I'm going to speak to you today about my experience with Vaser, how it started, and why Vaser, why I go for Vaser. So why Vaser, benefits, Vaser lipo technique. We're going to speak about the patient journey, pre and post-op. So as we know, the Vaser lipo it's produced really impressive result by treating different areas of fat in the body. with the ultrasound energy and very high efficiency of fat removal, and especially for the fibrous areas, which is a secondary liposuction. The instrument is used to liquefy the fat in different places in the body. And what I like it really is I'm using it under local anesthetic or under general anesthetic for the with sedation. The procedure I perform to my patients for volume reduction in patients that they have a nice shape, or they used to have a nice shape and relatively good quality of skin, or good skin quality. Why Vaser? Because patients are very happy with the result, smooth contouring, skin modulation, and eye-catching in a single procedure. So you can see the difference between before and after straight on the table in theater. The specific principles are that we want to easily remove, so we don't want to physically work hard to remove the fat. Physically, it's different, so easily we can remove the fat in the disproportionate areas and get adequate skin tightening for the result. Now, I want to talk about the Vaser lipo, for the high definition or the high definition. It is completely different. First, we aesthetically mark our patients in a completely different way to change the proportion of the body, to enhance the position of the waist and bring out all the muscular definition. And this is mostly in the male, not in the female, the muscular definition. The procedure is a very tissue selective, so it targets the fat. It doesn't target the soft tissue or the blood vessels or the nerve. It's protecting it. And it is a minimally invasive procedure with a less damage to the, or injury to the, compared to the traditional liposuction. Because I used to work with a traditional liposuction, and comparing my patients with the procedures done by the Vaser and the traditional liposuction is really, it's a massive difference for me in my practice. How Vaser worked. So basically, I have a small here video just to show it for you. I hope it will be interesting.
Liposelection offers an amazing range of possibilities. All of these areas have been successfully treated by liposelection, improving the self-esteem and confidence of thousands of patients. So how does this advanced fat removal technology work? Let's take a closer look at a cross-section of an area to be treated using liposelection. First, the area is filled with a special saline solution, expanding the fatty layer. This solution numbs the area and shrinks the blood vessels, thereby minimizing blood loss and reducing bruising. Then, using Vaser technology and liposelection technique, your doctor inserts a small patented probe that disperses ultrasonic energy, liquefying the soft fat cells on contact. The liposelection procedure targets only the fat cells for removal. This is the liposelection difference. Gentle suction and massage of the reshaped site removes liquefied fat cells with ease, again, without significantly damaging blood vessels, nerves, or connective tissues. Why is it important to leave these other tissues in place? If blood vessels and nerves aren't damaged, you experience minimal bruising and pain. Preserving these tissues enhances healing, which in turn promotes smooth and tight skin retraction.
Okay, so as we've seen in the video, the ultrasonic technology, it just targets the fat. It melts the fat, liquefy it without targeting any other blood vessels or soft tissues. Right. So after I met this gentleman nearly a year ago now, he told me, Jamil, Vaser is going to change your life. Actually, I didn't understand what he meant by that until I start working with Vaser. Jordomir, he's a good friend of mine, and he's a fantastic surgeon, really, and I'm learning a lot from him. So the Vaser technology has completely changed my life, because my life as a plastic surgeon in theater is becoming easier, has changed my patients' life and satisfaction as a result. And it has added a lot to our practice where we base now here, because we have a plan to do a fat grafting center with the Vaser Lipo Training Center, hopefully. This is the first case where I've taken 4.5 liters, really. And as you can see in the cancer, there's nearly less than 15% of blood or of oil, and the rest are pure fat. And I'm going to share another picture here with you guys. As you can see, the tissue structure here was taken endoscopically after doing the liposuction or the body contouring with the Vaser. And you can see it's still beautifully, the blood vessel and all the nerves still intact. There's no damage, as you can see. Okay, so I'm going to talk about the surgical procedure for the one I do. So infiltration, I follow the Temison mixture. There's a ratio 1:1, is super wet. And I use a normal saline 0.9% 1 liter mix with 1 ml of adrenaline and then bicarbonate. The reason I use a bicarbonate, it's really to decrease the toxicity of the lidocaine, and post-op, it's really proved that it will help with the pain. And especially if you're doing the procedure under local anesthetic, it really helps a lot with the pain. So yes, bicarbonate, you've got the ratios there, 10 mils per liter, and lidocaine 1%, infiltrated first deep and then superficial. And the reason for that you want first to infiltrate deep and then superficial, to make sure that when you are melting the fat, you go first superficial and then deep. So that's why. And then you go superficial lipo first, deep lipo second, and then intermediate lipo to create the negative spaces. And always you have to do, there's a question always, when you know when to stop. So the pinch test, which is 1 centimeter, you have to take. Okay, so, sorry. I thought here, patient selection or patient journey pre-op is very important, and it is really part of the treatment for your patient. You have to be very selective. So I divided the patient into high definition, 4D high definition, and for the body contouring. I don't like to say it liposuction anymore. I like, and I educate my patients about that, and I say, please say contour my body, sculpt my body, because we're doing here sculpture. So if I do the high definition or 4D or whatever, the 6 packs or whatever the patient wants, I go for the BMI of less than 27. If I'm doing the body contouring, I go with a BMI less than 30. So I divided my patient selection between the high definition and the body contouring. Very important to take a proper medical history. So past medical history is very important to make sure the patient is not diabetic, the patient hasn't got any cardiac diseases, any allergies, blah, blah, blah. And the medications, to make sure the patient, they're not on any anticoagulant medications. Smokers or non-smoker, if they smoke, they have to quit smoking 2 weeks before the surgery. Alcohol as well, 1 week before the surgery. Simon, this is for you. Supplements, vitamin B, C, E, A, and non-steroidal as well, not allowed. Protein diet patients, you have to be careful about them. Veggie patients. We have a patient, most of our work relies on patient coming from abroad. They come to us. So these guys, they have to arrive 2 days to the country to run all the blood tests, and they have to leave only after 1 week from the surgery. So that's a way how you make sure that, you know, you're safe. Sorry. Now, post-op. Something's going on here, guys. Post-op, still pre-op. Prophylactic, I give Claxin 40 milligrams for 2 days before the surgery and once a day. And then after the surgery, I give a BD, which is twice a day. They have to be fasted 6 hours before surgery. As my colleague, Dr. Jordi has mentioned, tranexamic acid, it's very important. There is a question as well, is there a risk of tranexamic acid, to develop thrombosis or PE? No, it doesn't. So this is why I did a lot of search about it and I start using it. I use 10 milligram per kg as well, half an hour before surgery. And if they are on high risk, I give them another after surgery, or I give them oral tranexamic acid for a couple of days, 2 or 3 days, until I remove the drains. The stocking is very important. So the Flotrone, before the surgery, the stocking, because the clot happens on the table. So we have to make sure that we use the compression stocking. And during the surgery, because it's a bit longer surgery, we use the Flotrone to avoid any complication. Ultrasound is very important because for the tummy to make sure there's no any hernias and avoid any unnecessarily complications as well. Post-op, drains are a must. So drains are really must. You have to know when to take them out as well. Blood tests, including group and safe, is very important. Compression garments as well. And make sure that the garment you wear your patient, they're not very tight, because a tight compression garment can lead to seromas because of the friction inside between the skin and the muscle. So that can lead to seromas as well. 40 massage for the first 48 hours, lymph drainage after surgery is very recommended. LPG, sometimes my patient, they say that we're going for LPGs, we're not going for the lymph drainage. That's fine as well. Make sure that, I normally learned that from Dr. Mayer, make sure there's small tiny incision. If you're doing the limbs upper or lower, it's always left open. You can put stair strip, it will drain out beautifully. To be honest, the post-op analgesia, honestly, from my 1 year experience with Vaser, my patients doesn't ask any painkillers after the procedure, nothing at all. I can tell that loudly. The patient, they want to leave after 5-6 hours. They don't even to stay in the hospital, which is shocking me. And I think this is not because I'm a very good doctor, or I think because of the Vaser and because of the mixture I'm using, which is the lidocaine and the bicarbonate. So I think so, because working longer. And they never call me back. They say, oh, we are in pain. Follow up, it is very important. You have to keep an eye after your patient, after the Vaser procedure, because you want to make sure you're having good result and delivering the best for your patients. I'm going to share with you some of my results here. This lady, she has come to me for a tummy tuck, which I refused to do a tummy tuck and or abdominoplasty, and I offered her a Vaser, and she was recommended, to be honest, by a friend of hers. I offered her a BBL as well, but she didn't want it. But you can see the result. This is 5 weeks after the surgery. Only 5 weeks after surgery, we got into this result. The patient was over the moon. This is another patient. This was actually one of my first patients. She was very unhappy patient with another procedures, tummy tuck. She was secondary liposuction as well with her breast. Anyway, this result after 10 days from the surgery. And here is the result after 5 weeks from the surgery. And I wrote her, I don't know if you can see on the screen here. I wrote, hi, how are you? She said, good morning. I said, how are you feeling? She said, could be better, hell no. So I was really super happy with and very satisfied. And this lady, she's recommending a lot of patients to us as well. So that's why I'm talking about the patient satisfaction. This is a patient which I wanted to share with you as well, straight after surgery. This is second day after surgery. It's actually, he had a gynecomastia and he had some lipofilling to his pectoralis muscle. And you can see really, he came here as well for tummy tuck. I said, no. Actually, Dr. Mir, he helped me take a decision on this gentleman. Really, thank you, Jordi. But it is really, I think it's a fantastic result, straight on, and that's the eye-catching. That's what I meant. You can see your results straight away. There's another lady combined a tummy tuck. We were very conservative about doing liposuction with the tummy tuck because of the flap and the perforator. So we want to avoid any complications and necrosis. And you can see the results really. Wow, super as well. This lady, she's in Canada now. This is another, I use Vaser as well for a lot of double chins. This is a lady straight after with some fat grafting to the chin and straight after, fresh after the surgery. And you can see, you can judge the result. This is one of the patients I was really happy with, guys. It's super changing. This is 6 weeks after the surgery, the last picture. You can see when she came in first, and then this is straight after the procedure, and you can see after 2 weeks, and then after 6 weeks, over the moon. I wasn't able to achieve these results with the mechanical. This is another one here. We basically, this lady, you can see she has a twice liposuction in the past. She has cesarean section, which she wasn't really happy about. And in the picture, you can see some irregularity in the first picture. So yeah, I did the third time on her. It wasn't my patient, but you can see the changes as well in the last picture. And this is after 3 weeks in the last picture. So we talk about the complications, as we know, burns, it can happen. It never happened with me, skin burn. Or can happen some necrosis, hemophilic shock. It can happen basically seromas. This is mostly which can happen with any other surgery. But the most important is that you follow up your patient after the surgery. You stick to the rules where you can avoid any complications. You follow up your patients, keep an eye on them. And this is very important in my practice with Vaser. I find it really easy to work with. I find it really achieving a good result as far as you're sticking to the rules. So I want to thank you guys here. And it's very simple. Vaser patient experience, less pain, less swelling, less bruising compared to any other liposuction or traditional liposuction treatments. Thank you very much, guys.
Спасибо, Джамиль, огромное за презентацию. Было много вопросов, да, и я вот, пожалуй, на часть из них вы уже ответили. Скажите, пожалуйста, в плане сохранения дренажей в послеоперационном периоде, от чего зависит длительность нахождения дренажей и вот какой диапазон, который вы рекомендуете?
Actually, I leave the drains until there is less than 30 to 40 mils in the drain. So what I do is we keep the drains for, it doesn't matter. There is no certain time you have to, but it is the surgeon judgment. I normally remove the drains when it's only 30 to 40 mils in the drain. So I think it's quite enough so we can remove it out with a straight away lymph drainage or massage. Can you hear me, guys?
Мы задаем этот вопрос по той причине, что часто от хирургов получаем возражение, что в послеоперационном периоде ткани плачут дольше, чем после обычной липосакции. эксудация длится дольше. Как вы думаете, с чем это связано? Или это заблуждение?
Process is longer than after traditional liposuction. Do you think this is just a mistake or this is true? What is your opinion on this matter?
I'm not going to say it is a mistake, but it's not true. So it's not true at all.
Спасибо.
Thank you very much.
А с точки зрения длительности самого хирургического вмешательства, хирургу требуется больше времени на удаление жира, используя Vaser-технологию, или столько же, как при других методах? С какими вы можете сравнить Vaser?
Time for the procedure than with the traditional liposuction. What are the time you need for procedures? Is it longer, shorter?
It is a good question, really. Yes, I agree. With Vaser, it might take a little bit longer, but we have to agree about one thing. Any big area to liposuct is going to take a long time to achieve the result. So for the surgeon to work, it will take him longer. If he's doing the tummy, the flanks, the back, it's going to take him some time as well. So any big area to sculpt is going to take, whether in the Vaser or in the mechanical, but we're not going to look into time more than we're going to look about the after surgery result, how we're going to achieve the best result. And why I like it, I don't think you can achieve a mechanical liposuction on the patient under local anesthetic much, really. So most of the surgeon, they put them to sleep. So what I'm trying to do is, most of the time, I don't do the back, but I do the flanks, I do the sides, I do the tummy, I do the legs under local anesthetic with sedation sometimes. So it depends on the patient.
Понятно. Саймон хотел что-то добавить, да?
I just wanted to add, this issue of time comes up quite a lot, and from my experience talking to hundreds of plastic surgeons that have moved up into the Vaser world, they seem to say that initially, yes, it does take a bit more time because there are 3 steps: infusion, vasering, and then aspiration. What they seem to find later on is that the time they take to emulsify, to apply the ultrasound, they gain that time back in the aspiration phase because you're aspirating liquid, you're not trying to aspirate semi-solid fat. So over time, with practice, most plastic surgeons who move to Vaser find that their operating time for the same procedure eventually comes to be the same. So you're buying aspiration time by investing in the emulsification time, if that makes sense.
And the teamwork is very important here. So you have to have a team. Vaser is designed to work in a team, and to work probably 2 plastic surgeons and anesthesiology and assistants. So basically, you should have a trained team to buy this time as well. I don't know, Jordi and Simon, you agree about that?
Yeah, well, very important, the team. Please.
Вы предупредили мой следующий вопрос. Да. Доктор Мир хочет что-то добавить, да?
Yeah.
Dr. Mir, would you continue? Yes.
It's very important, the team. So don't do a total body surgery alone. As Hamil was saying, be 2 plastic surgeons. That's perfect. Our surgery time is the same as it was in a normal lipo now. Why? Because after the learning curve, as Simon said, the time that you use with Vaser, it's less time that you need with the lipo. And there is another important aspect, that if you're doing a total body surgery, you will probably have 2 plastic surgeons, so you will have 2 aspiration machines, why don't have before 2 Vaser machines in order that 2 plastic surgeons can do Vaser, and instead of doing 40 minutes of Vaser, you do 20 minutes.
И у меня остался последний вопрос к доктору Джамилю. Скажите, пожалуйста, вы показали пациентку, где вы ее взяли на Vaser липосакцию после уже ранее проведенной липосакции. Скажите, пожалуйста, какие бывают трудности при повторных операциях, и есть ли у Vaser преимущество в этой технологии?
What are the advantages of a Vaser if we compare it to these complicated cases where the patients had already bad experience with liposuction previously?
It's actually the patient, she has come to me with a lot of irregularity after the first and second liposuction. Which she was keen really that she achieves a better result. And then I think, in my opinion, that working with Vaser to achieve a secondary liposuction, we can get a really good result. I will get Simon as well to help with this question really.
Yeah, thanks, Jamil. I think because of the selectivity of Vaser for secondary procedures or tertiary procedures, where you have a lot of fibrous tissue in that matrix, I think the selectivity of Vaser makes the secondary procedure easier to accomplish. And again, because you are aspirating a liquid, you can revise and get very smooth results and fix those irregularities that you may have seen from the earlier procedures. I think Jordi will also agree that for secondary procedures, Vaser is an excellent tool to have in your practice. Jordi?
Yeah. Before, when you... Yes?
Осталась 1 минута в эфире, коллеги. Час пролетел совершенно незаметно.
1 minute and 1 hour just passed by like 1 second.
Спасибо вам огромное за ваше время, и мы счастливы, что мы смогли познакомить огромную аудиторию. Нас смотрело больше 150 человек только в первом часе, но я надеюсь, что все, кто не нашли времени для этого, легко и просто по ссылочке зайдут на наш портал и легко посмотрят это все в YouTube-записи. Поэтому спасибо вам еще раз огромное, и мы очень рассчитываем еще на одну встречу с вами вскоре. Сейчас будет небольшой технический перерыв, когда мы подключим несколько российских хирургов. И доброго вам дня!